So thank you for the opportunity to highlight our work at ASCO GU. This project was titled Angiogenic and T-effector subgroups identified by gene expression profiling and propensity for PBRM1 and BAP1 alterations in clear cell renal cell carcinoma. So, with the emergence of multiple active treatments for metastatic kidney cancer, we also had an emergence of data regarding RNA-seq data to help with treatment selection. These data derive from trials such as Emotion 151 and Javelin Renal that kind of generated angiogenic and immunogenic signatures that warrant further validation. So really in this effort, which does represent a true multi-institutional effort among several academic institutions within the country, that we got together and we felt it would make sense to kind of run RNA-seq analysis on a large database provided by a commercially available tissue-based sequencing KERAS. And so what we did is we digged into KERAS database. We identified consecutive patients with sample stored and sequenced from patients with clear cell renal cell carcinoma. And we performed the gene expression profiling and we ran the cluster analysis. I have to briefly remind us that the analysis that we did on that on this cohort of 316 patients was actually kind of an optimized analysis from the Emotion 150 trial that's also published by the Costa and colleagues about a year ago. And so we kind of ran the same cluster analysis on this database. And so in summary, our cohort was mainly men who included both who had tumor available from primary and metastatic sites. And we were able to identify, indeed, an angiogenic signature in about a quarter of the times in this cohort, in another 25% of the times, a T-effector signature, so an immunogenic signature and angiogenic signature present in about half of the times. On the other half, there was a mixed signature present there. Interestingly enough, patients with angiogenic signature were found to be associated with more GI metastases, such as pancreas and small bowel. Also, they tend to be women and older. And these findings were quite interesting to us, and and we got to understand if this holds true in further studies. In opposition to that, the immunogenic signature was, was associated with BAP1 mutations, also associated with an immune cell population abundance, such as NK cells, monocytes, and also immune checkpoint gene expression, such as TIM3, PD-L1, PD-L2, CTLA4, and also associated, increasingly associated with PD-L1 expression, as well as tumor mutational burden and MSI, MMR, although the last two without statistical significance. There was, though, a trend towards that association. So in summary, what we saw from this work is was the findings were in line with prior studies that angiogenic signatures were found in a subset of these patients, and were associated with with women, older patients, and also PBRM1 mutations, whereas the T-effector immunogenic signatures were identified or associated with markers that were commonly seen in tumors who tend to respond to immunotherapy. I guess next steps for this project would include expanding this database, and we would like to explore things like comparison of the signatures between primary tumor and metastatic sites, as well as go beyond the clear cell and try to understand really what's happening in terms of RNA-seq data in the non-clear cell histologies. And finally, you know, we'll try to get clinical annotation on these data set and kind of run the association between what we're finding at the gene expression level and trying to identify the impact on treatment and clinical outcomes of these patients.